Hello, I'm Lisa Licks. I'm a professor at the University of Manitoba, and I'm part of the Health Data Research Network Canada, under which this talk about an algorithms inventory for health and social measures that was constructed by the Canadian Data Platform was formed. Health Data Research Network Canada is an affiliation of multiple provincial, territorial, and pan-Canadian organizations that are responsible for electronic health and social data in Canada. The Canadian Data Platform is the first initiative of HDRN Canada and is designed to help support researchers as they conduct multi-jurisdictional research. Our goal in developing the algorithms inventory was to help share expertise around how we measure important constructs of population health, health service use, and the determinants of health across Canada. HDRN Canada has a number of objectives, but for the purposes of this presentation, I'm focusing on its objective to harmonize definitions, or in other words, algorithms, for key measures of population health. And so that's how the algorithms inventory was born. The Algorithms and Harmonized Data Working Group that was formed as part of HDRN Canada and that supports researchers who use this Canadian data platform was critical to the ongoing work. Now, the working group has a number of strategic priorities that it's focusing on. Its objectives around harmonized data involved, first of all, identifying published measures of population health, health service use, and the determinants of health that have been validated, in other words, that have been assessed for their accuracy, or that have been assessed for their feasibility of implementation. In other words, can they be used and do they have face validity across multiple provinces and territories in order to support multi-jurisdictional Canadian studies of health or health service use? So that was the first objective. And the second was to create this inventory and make it available as an online resource for researchers across Canada as well as internationally. In developing the algorithms inventory, we recognized that there could be a substantial volume of published literature around measures of population health, health service use, or the determinants of health that have been tested for feasibility or validated across Canada. So we initially started focusing on published works around chronic or acute health conditions. This could include things like diabetes, hypertension, or asthma. Currently, we are reviewing published literature to identify algorithms that measure the determinants of health, such as the income level of the population, its degree of social deprivation, and as well measures of race and ethnicity, which are critically important as we examine health equity issues in Canada. Most of these algorithms are based on Statistics Canada census data. After that, we'll go back into the literature and look for published algorithms that have been constructed for measuring healthcare utilization across the Canadian population, such as surgical procedures and heavy users of the healthcare system, such as those that are high-cost users. Our literature review process to identify published algorithms is standardized, and it has involved looking at multiple citation databases with critical questions around the use of validation methodologies or feasibility methodologies. We have included only studies that have used data from 2 or more Canadian provinces or territories and that have used large electronic health databases, such as administrative data or registries that compile health or social characteristics of the population. Throughout our process, there's been an emphasis on quality control and on input from the Algorithms and Harmonized Data Working Group to ensure that we screen out only relevant articles and that we have a commitment to ensure that the information that is extracted from the articles about algorithms is reproducible the process is transparent. This diagram illustrates the multi-step process that we've gone through identifying relevant literature sources and working intensively in a group setting to identify the fields that we would use for data extraction, to having multiple individuals participate in that process, to quality control checks to ensure that there's accuracy of the information that is extracted. That's been done through some of our staff, as well as later on involving the authors of studies that have been part of these literature reviews, being able to review the extracted information. We've revised the data extraction form along the way to be responsive to the many attributes of published algorithms that are available in the articles. There's been review throughout by members of the working group and those that have expertise in development and using algorithms. And the end result has been a searchable tool that is available through the Canadian Data Platform's Data Access Support Hub website. Through our first phase of looking at the published literature that focused on acute and chronic health conditions, we identified a total of 34 articles up until 2019. 8 of these specifically were validation studies that looked at the accuracy of algorithms around chronic and acute health conditions across multiple jurisdictions. And another 26 were feasibility studies that focused on looking at the face validity and the ability to implement algorithms across 2 or more jurisdictions. The health conditions that were represented most commonly in this extracted literature were around physical health conditions, including diabetes, depression, hypertension, and dementia. And the provinces of British Columbia and my own of Manitoba were most frequently represented in the studies that had been done, illustrating that there have been multiple instances of comparability of the accuracy of health conditions in these 2 provinces. At the bottom of this particular slide is the link for the algorithms inventory that you can go and explore when you are able. This screenshot shows the information that is available through the algorithms inventory and some of the search functions of it. We've standardized our terminology in order to improve searchability. In this particular slide, you can see that it's possible to search on major categories of algorithms. So, for example, different chapters of ICD are represented in these broad categories. And then there are more specific categories that focus on the specific acute or chronic health conditions that are represented. And then it's also possible to search on the jurisdiction that was represented in the validation or feasibility work that was undertaken. There's a link with each of the articles that was extracted and the algorithm that's subsequently recorded so that individuals can go back to the original source to look at the attributes of the information themselves. This second snapshot of the algorithms inventory shows the kind of information that we extracted, which included aspects of the validation, so measures of accuracy that were reported, the source of data, including at both the provincial or territorial level, and the specific database that was used to construct the algorithm, whether it was hospital records or it might be physician service claims, what the validation data source was for those studies that involved that, and elements of the study itself. So the period over which data were collected and the characteristics of the cohort that was involved in the validation initiative by age and by sex in particular. And then the specific codes that were used to define, for example, an algorithm for diabetes are captured here. So I've described for you an algorithms inventory that was produced through the Canadian Data Platform as part of Health Data Research Network Canada, an initiative that cuts across the provinces and territories in Canada. This infrastructure is helping to support improved data access, as well as ongoing engagement with a variety of groups. We're excited that the algorithms inventory is a national tool that will help to support efficient and reproducible multi-jurisdictional research about health and health service use in Canada. Thanks for watching my presentation.